Yeah, low amniotic fluid. That's a good one. So the medical term is oligohydramnios, and at term, this is a common indication for delivery. And um, so first of all, how do you define oligohydramnios? So this is important, and um, there's three ways to measure amniotic fluid on ultrasound. Um, One way is just subjective appearance. You put the ultrasound probe, you kind of look around, and you say, oh, that looks normal. Oh, that looks like a lot of fluid. Oh, that looks low. So there's just the subjective reading. I think these days most people will actually take a measurement. And there's two ways to measure. So one is called the amniotic fluid index. And to take this measurement, what you do is you divide the belly into four quadrants using the belly button as the midpoint. So you do a horizontal line and a vertical line with the belly button right in the middle, and then you've got these four quadrants. And you take a measurement in each of the four quadrants. You take the deepest pocket of fluid and you measure it in centimeters, and then you add up your four numbers. So if there was a 2 centimeter pocket in each of your four quadrants, that would add up to 8, and your amniotic fluid index, or AFI, would be 8. And normal is defined as anywhere between 5 and 24. Um, so by the amniotic fluid index method, if you get an AFI under 5, that would be called oligohydramnios, and that would be an indication for inducing labor. Um, and it's very commonly done. Another way of measuring amniotic fluid is the deepest vertical pocket method. So you scan around the uterus, you look at all the fluid, and you find the deepest pockets you can find. And if you've got one pocket that measures over 2 centimeters, then you've got normal amniotic fluid. And if there's no pocket that you can find that measures 2 centimeters, then you've got oligohydramnios. So if you got a 1.5 in each of your four quadrants, that would be oligohydramnios, because you have no pocket of 2 centimeters.
Mhm.
Now, what's interesting is you can have amniotic fluid that is abnormal by one of those methods and normal by the other method.
Right.
Let's say you identify one single 3 centimeter pocket and you find no fluid anywhere else. So you got 3 centimeters. So by the AFI method, you're under 5, that's abnormal. But by the deepest vertical pocket method, you're over 2, so it's normal.
Mhm.
Um, so there have been some studies that have shown that if you use the deepest vertical pocket method, which is going to identify fewer cases of oligohydramnios because of the reasons the example we just went through, you're going to recommend a lower number of inductions, but your perinatal outcomes are going to be the same. In other words, this is not dangerous. You're not going to find all of a sudden babies dying from low fluid because you've allowed it to go too low. So the deepest vertical pocket method appears to be safe compared to the amniotic fluid volume method, but it results in a lower number of interventions. Um,
Mm.
and I think over time there's been gravitation toward the deepest vertical pocket method for that reason. But there's still people using the amniotic fluid index. I think it's still very common. Um, so what I have seen is inductions of labor for amniotic fluid of 8. Um, that's getting lowish. I think we should induce labor. That is not appropriate because by both measurement, that is normal amniotic fluid volume. And I don't like these terms like lowish. It's sort of, misleading, kind of implies that there might be something wrong going on here. To my way of thinking, if you're in the normal range, you're in the normal range. And then the word that I use is normal. Your amniotic fluid volume is 5.1. That is normal. Um, so you see a lot of that. I think if you're being recommended to induce labor because your amniotic fluid index is 9, I think it's fair game to challenge that. Um, Now, if your amniotic fluid is below 5, that is an induction of labor that I think goes along with current guidelines. It's not inappropriate, but I think you could challenge it on the basis of the fluid being over 2, which is also according to guidelines. And by that reading, would be considered normal amniotic fluid. And in my practice, that's the reading I use, an amniotic fluid volume of 2. Um, so if you're sort of in that you're abnormal by AFI method, but normal by deepest vertical pocket method, and someone recommends induction of labor, I don't think that's medically inappropriate, but I think it's reasonable to challenge that. If your fluid is under 2 and you're being recommended to induce labor, I think uh, that's medically appropriate. It's according to guidelines. Um, Now, can you challenge that? Um, yes, you can. Um, the I wouldn't, I'm not necessarily recommending this or advocating this. Like I said, I do follow national guidelines and professional society recommendations. Um, but we also want to understand the tests that we do and the recommendations that we make, and the impact that this has on the community, and um, and so the idea that low amniotic fluid is dangerous is a deeply entrenched idea in obstetric practice. And it came from older studies where they looked at pregnancies where the amniotic fluid was low, and they found that the risk of perinatal mortality or death around the time of delivery, either before or shortly after, was increased. And so low amniotic fluid was identified as something that identifies pregnancies that are at risk, at higher risk for loss. The problem with old studies is they're unsophisticated and have a lot of methodological problems. One of which was these studies tended to include a lot of babies with abnormalities. And so you might be seeing low fluid as a consequence of the abnormality, and you might see a fetal loss related to the abnormality, and the fluid is sort of a red herring or an innocent bystander that's not really the cause of things. And so there have been some more recent studies that have looked at this, that have tried to identify a cleaner population of pregnancies that are normal, where the baby's growing normally. There don't appear to be any abnormalities. And so you're taking out the growth restricted pregnancies, you're taking out the fetal anomalies, and you're just looking at pregnancies that are otherwise appear to be going fine. And in some of these studies, they have not found the same relationship between low fluid and perinatal mortality. The problem is the studies are kind of small. So are they large enough to really undo this deeply entrenched dogma? And could it be that if you did much larger of these studies, maybe you would actually see some adverse outcomes tied to low fluid, and maybe it is dangerous. So are these studies good enough to undo that concept? Probably not. Um, there have been some randomized trials where they take these pregnancies where everything seems fine, but the fluid is low, and they randomize them to either ending the pregnancy or continuing to monitor, and have found no difference in perinatal outcomes. In other words, it wasn't dangerous to follow those pregnancies. Those babies did the same as the babies that were induced right away. But again, these studies are very small. So is that safe to do if we're talking about the 4 million births that we have in this country every year? That's harder to say. Um, it would require, I think, um, a lot more data to undo this concept that low fluid is dangerous. So um, all I'm saying is that it's possible that in normal pregnancies, low fluid may not be as dangerous as historically we have thought. Um, I still think it's prudent to follow recommendations, and I do recommend that. But I don't like to scare people about it, because, this may not be as dangerous as, we have historically believed. I do like to use the maximum vertical pocket method as opposed to the AFI method, because that's going to reduce the number of inductions that we perform, and it leads to apparently the same outcomes. Um, so that's my take on the low fluid.